we've seen a lot of really misrepresentations, frankly some flat-out lies being done mostly for political purposes, we think, to kind of knock the president down more than knock healthcare down. I think there's a shared understanding by all Americans that we really need to fix our system.
What are some of the biggest myths or lies or just distortions?
You know, the one for this week, of course, is this really pernicious misstatement about the provision in the bill, and it's just one little provision in a very long bill, allowing Medicare to pay for end-of-life counseling, that this somehow will lead to rationing of care or even euthanasia, which is just utterly ridiculous. That's not in the bill at all.
What would it do?
All it does is allow doctors to get reimbursed for something that they need to be doing now anyway, which is talk to patients before their life gets critical about what their wishes are, so that the doctors understand what their patients want best, and they can have that conversation before it gets too emotional.
And so they would be maybe talking to them about having healthcare proxies?
Healthcare proxies, advanced directives, living wills. Massachusetts has the infrastructure to do that, but we really need Medicare to pay for just for the cost of providing that service. There are doctors, particularly doctors that specialize in the elderly, really have some training on how to have these discussions and understand both the patient's condition and the treatment options available to that patient, and how to have that conversation in a way that recognizes the patient's values and lets the patient express his or her own values. It's such a relatively minor part of the bill for the opponents to blow this one provision up and say this shows that health reform is on the wrong track. We think is really missing the boat. You know, there are some 47 million uninsured Americans. We need to get them covered, and then the cost of care is way too high. We need to reduce the cost of care. That's the big picture.
Are we going to really have health reform?
I'm still optimistic. I mean, it certainly looks toughest, but I remember in Massachusetts we had an impasse here for 4 or 5 months where both sides were dug in and said no, 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 and then when they got to yes, there were smiles and hugs all around. It's always darkest before the deal is one of my favorite sort of aphorisms. I think they're going to come to terms and find a way to do it, because the consequences of not doing health reform are really untenable. The cost of coverage is just bankrupting America and families, and the quality of coverage is going downhill. We need to boost it up. The Senate is looking for a mid-September deadline of trying to get the bill out of committee. Then it will go to the floor. I think the end of the calendar year is what we're looking at, sometime in November, December.
This is Sue Scheibel, staff reporter for the Patriot Ledger. For more coverage, see today's newspaper or go to patriotledger.com.